Thank you all so much for joining. So we're going to go ahead and start with introductions. Thank you again for being here and taking the time to participate in our Measuring Safety launch. This is the third launch of our reports for this year. My name is Maralia Negron. I use she, her pronouns, and I serve as our Director of Policy, Advocacy, and Research. And we're very excited to be presenting today our Measuring Safety report on the Illinois Domestic Violence Hotline for calls and services provided in 2024. So with that, I will pass it over to my amazing colleagues to lead us through the presentation and introduce themselves.
Great. Thanks, Marlia. Hi, everyone. My name is Shelby Hoffman-Binder. I use she, her pronouns, and I serve as manager on our policy, advocacy, and research team here at the network. I'll pass it over to my colleague, Imuna, for a quick introduction as well.
Hey everyone, my name is Emil Kirkland. I serve as the Data and Research Associate for the Policy Advocacy Research Team for the network.
All righty. Well, with those out of the way, we can go ahead and jump right in. There's lots of great information to talk through today. And we're really excited to have you all here for Volume 3 of Measuring Safety, all about the Illinois Domestic Violence Hotline. Just to give folks a quick roadmap of what we will be covering today, we have some introductory information to kick things off. If this is anybody's first time at a network event or specifically at a Measuring Safety launch, we'll get you oriented as we start. And then we have a lot of really rich data to share directly from the Illinois Domestic Violence Hotline. That's going to come to you in 3 parts. First, we'll cover some overview contact data, looking at who's contacting us, how often, and from where. And then we'll move into survivor needs data. So looking at what kinds of services folks request when they call. And then we'll round things out with a little bit of data about some programs and processes that the hotline operates to fill gaps in services when we see that there are more requests than perhaps our service environment can meet. Once we wrap that up, we do have a fun sneak peek to share with all of you of a database we are very excited to be launching on our website later this year. And we will have time for questions at the end of today's presentation. So please feel free to use that Q&A box and the chat function throughout our conversation today. And we will review all of those questions at the end. So drop your thoughts there. No need to wait until the end if something is really on your mind. And Maralia will be raising those questions for us at the end of our call today. Let's get into some of that introductory information first. For folks who don't know us, we here at the network are a coalition of organizations that are working to end gender-based violence. We do that through a number of different avenues. First and foremost, we are the proud operators of the Illinois Domestic Violence Hotline, which is a resource for domestic violence survivors available 24/7, 365. That's obviously the center of today's discussion, and we'll talk more about the hotline. So if you have questions there, we'll get to them. We do a lot of other work as well. We engage survivors directly in other spaces through our Survivor Fund and housing advocacy program, making sure that survivors are resourced and able to enforce their rights. We also do a lot of work directly with our membership of more than 45 direct service organizations here in the Chicagoland area. Folks who are doing domestic violence, sexual assault, and human trafficking work make up that coalition, and we serve them through provision of trainings and advocacy work. And of course, we are engaged in a wide variety of advocacy work, specifically aiming to support survivor-centered policies across the state. We do that at the state, county, and local level. Measuring safety is a part of that advocacy work, making sure that our community is informed about survivor issues such that we can provide services that meet people's needs and support evidence-based policies that support survivors in whatever stage of the process they are in. Measuring Safety itself is a data report series that we've been publishing here at the network since 2020. And it is specifically focused on experiences of gender-based violence in Illinois, and also the sort of responding service environment that those survivors might interact with. It's really one of a kind. We're very proud of the work we do with measuring safety. And this year is the second year that we are publishing it in volumes. So we're releasing this information in sort of targeted batches so that you can educate yourselves on resources like the hotline or our Survivor Fund program, or things like policy issues that are coming out of the Illinois General Assembly. Those reports can always be found on our website, and we'll be sure to share a link to that later today as well. We do always like to uplift for folks that we are gathering statistics and also highlighting qualitative data through stories from staff in the field as well as survivors themselves. And while this is a very data-rich report, it is not a scientific study, so we aren't going to be sharing causal conclusions as a result of this report, but we will do our best to make some educated hypotheses when necessary. We really see measuring safety as a tool for advocacy, as a tool for fundraising, and as a tool for education. And we hope that you come to see it that way too. To orient you a little bit to today's report, which, like we've mentioned, is focused exclusively on the Illinois Domestic Violence Hotline, the data that underlies this report kind of comes from three key places. The folks who work at the hotline are called VIRAs. That stands for Victim Information and Referral Advocates. And they record most of their daily activities in a web-based database called iCarol. This records logistical information like how long a call is and where the call comes from, but it also records all of the resources that somebody requests and the kinds of places where we refer them. This is the majority of the data that we are looking at today. We do also have some really wonderful VIRA stories in the report as well, that sort of qualitative piece of our data analysis that really bring some life to the stories behind each individual call. Those come directly from VIRAs who report anonymized stories as a part of their grant reporting requirements throughout the year. And we take some of those and republish them here for a wider audience. Lastly, there is one program that the hotline operates that tracks its data in a different place, and that is our Safe Rides program. Safe Rides program is operated in conjunction with Uber Health. It's a little bit different than your standard Uber ride, and we'll talk about that more later. But what you need to know is that we export data directly from Uber Health when we're analyzing the impact and reach of our Safe Rides program. I think the only other foundational piece of information you might all need is a little bit more background on the hotline itself. The hotline actually started all the way back in 1998, and it was a project of the city of Chicago. It was meant to be a free 24/7 helpline that connected survivors of domestic violence with local resources. The network has been the very proud operator of the hotline ever since its invention in 1998, and we've held that contract ever since. In 2008, we were very pleased to expand the hotline's reach so that it was no longer just the city of Chicago, but rather a statewide hotline. And we now reach folks all across the state of Illinois. And honestly, we reach folks well outside of the state of Illinois too. We'll talk about that a bit later. Folks are able to contact us via three key methods. They can call our phone number. They can also text our phone number, and they can send us a chat via the network's website. And across those three different methods, we are available 24 hours a day, 7 days a week, 365 days a year. And we are able to communicate with folks in more than 240 languages, thanks to a combination of an intentionally curated multilingual staff and the services of a program called the Language Line, which allows us to bring in interpreters when we don't have somebody on staff who speaks the language of our caller. With all of that said, we're nearly done with our introduction, but the last thing I really want to raise before we get into the numbers is that none of this would be possible without the incredible staff at the Illinois Domestic Violence Hotline, and I know some of them are in the room, so this is a big thank you to you. Really, your skill and compassion and commitment to excellence is what underlies all of this. It's what allows survivors across the state to be able to access those life-saving resources, and of course, it allows us to talk about the great work that you do, because they have done the great gift of recording all of their work for us. So a big thank you to them. None of this would be possible without their excellence. With all of that out of the way, I will turn things over to Imuna and we'll dive into the data.
Thank you, Shelby. In this next section, we're going to go over contacts to the Illinois Domestic Violence Hotline in 2024. In 2024, the Illinois Domestic Violence Hotline received nearly 60,000 contacts to the hotline. We receive contacts in three types. We receive calls, which made up nearly 56,000 contacts to the hotline. We receive texts as well, which made nearly 2,500 contacts to the hotline. And we also received chats, which was around 1,300 contacts to the hotline. Contacts to the hotline, the total 60,000 calls increased 26% from 2023. That's more than 2 times the contacts we received compared to pre-pandemic 2019. And it encompasses far beyond the state of Illinois. It reaches 46 states and 4 Canadian provinces. Our VERAs, the people who answer contacts to the hotline, they spend around 20 hours per day assisting survivors through the hotline. That's about 163 contacts per day. That's a significant amount of time that VERAs spend assisting survivors and accessing resources. And you really get to see how we can get to 60,000 contacts by the sheer volume that we get in one day. The hotline received more than 2,000 non-English language calls in 2024. The hotline is equipped to communicate with callers from over 240 languages via tools like Shelby mentioned, our language line, our live interpretation service, and also through our multilingual VERA staff, who translated about 24% of non-English calls this year. The previous year in 2024. Of those roughly 2,000 calls, there were 45 different non-English languages that contacts used to call into the hotline. 77% of non-English language calls were in Spanish, 4% were in Arabic, 3% were in Amharic, 3% were in Rohingya, and 2% in Polish. Those are the top 5 non-English language used in calls to the Illinois Domestic Violence Hotline. This indicates the large reach that the hotline has and also the diverse range of contacts that the hotline receives every year. Growth to contacts to the Illinois Domestic Violence Hotline continues to grow significantly year after year across the state. In Illinois specifically, there were 58,000, nearly 59,000 calls to the hotline. That represents the vast majority of calls to the hotline. There are also 30,000 contacts to the hotline in Cook County and 1,800, nearly 1,900 contacts to the hotline in Chicago. Cook County is the largest county in Chicago, so that makes sense why we receive a large amount of contacts from that area. And the growth in contacts to the hotline does not necessarily reflect a growth in domestic violence. What it could reflect is a growth in the awareness and capacity of the hotline as more survivors call into the hotline to receive help and become aware of the services that the hotline provides. As the reach of the hotline grows, it's very important that the capacity of our services expand to accommodate the growth of survivors as well. Illinois contacts came from 96 out of 102 counties across the state. As always, this is typical across the years. The highest concentration of contacts to the hotline came from Cook and the surrounding suburban counties, the collar counties. The areas with the largest growth, however, were in central Illinois. This aligns with staffing changes that we had in 2024. The hotline expanded its staff to include 2 Southern Illinois Supportive Services coordinators. They had the explicit goal of supporting efforts to reach and serve more survivors in Central and Southern Illinois. And we can see the fruits of that labor in the numbers, as we see that Central Illinois had the largest amount of growth, the largest change in callers in 2024. All of the top 5 contact counties outside of Cook came from the collar counties and saw growth in contacts in 2024. Compared to 2023, the collar counties saw increases between 14% and 47%, depending on the county. Lake County in particular overtook DuPage as the top contacted county outside of Cook, with a 36% increase to contacts compared to 2023. This data aligns with trends of increased contacts to the hotline overall and increased demand for services across the state. The city of Chicago also saw an increase to the contacts in 2024. It saw a 17% increase compared to 2023 and nearly an 80% increase compared to pre-pandemic 2019. Areas in the far south and near west sides of Chicago contacted the hotline at a much higher frequency than communities on the far north side or near downtown. The 5 highest contact zip codes to Chicago in 2024 were 60617. This encompasses the neighborhood of South Chicago, South Deering, Eastside, and Calumet Heights. Next, we had 60649. That's the neighborhood of South Shore. 60612 was the neighborhood of near West Side and East Garfield Park. 60620, that's the neighborhood of Auburn Gresham, and Washington Heights, as well as 60622, which is the neighborhood of Westtown. The increase in contacts in these areas shows a growing need in these communities for support. In this next section, I'm going to talk about survivor needs. Survivors can contact the hotline about a variety of needs, and we record every instance in which a survivor asks for a certain resource. So we're going to talk about some of the most popular resources in these categories. The hotline tracks 44 different service needs among callers, and every instance in which a service need is mentioned, we record. That means if a survivor contacts the hotline and they say they need help with DV shelter, but they also need help with filing an order of protection, and they also would like counseling services, we record every instance, every need that is mentioned by the survivor. The Measuring Safety Report does not cover all 44 service needs, but we do cover the top 10 service needs articulated in calls in 2024. This particular presentation will focus on a selection of notable trends within the top 10 survivor needs. We'll briefly go over the top 10 service needs, what they mean, and how many contacts mention those needs. We'll also go over the shelter and affordable housing trends, legal advocacy trends, and public benefits and financial aid trends. The top 10 needs among survivors in Chicago and Illinois are the same, meaning that 1 in 10 are not necessarily the same. Sorry, let me explain it a different way. Number 1 for Illinois might not be number 1 for Chicago, but in the top 10, they all have the same categories. Understanding the top needs among survivors helps us to evaluate the GBV service environment and helps us figure out if services are providing the resources that survivors need. So number 1 for both Illinois and Chicago was domestic violence shelter. A person can call for shelter more than once, and often the survivor might contact the hotline multiple times in order to be successfully placed in a shelter. The number of domestic violence shelter requests reflects the total number of requests, even if multiple requests come from one survivor. In Illinois, nearly 19,000 survivors requested assistance with domestic violence shelter. And in Chicago, nearly 7,000 survivors requested domestic violence shelter assistance. For number 2, for both Illinois and Chicago, were requests for information. This is information that might not lead to a direct link to services, but helps a survivor understand a situation that they're in. A survivor might call to understand abuse or domestic violence relationships, to learn about their rights, or to get information about resources. In Illinois, nearly 18,500 survivors requested information, and in Chicago, nearly 5,500 survivors requested information. Number 3 in Illinois is not number 3 for Chicago. In number 3 for Illinois, that was direct links to services. This is a situation where a survivor is ready to be connected with a resource, and a VERA can assist them by contacting the resource and performing a warm handoff, helping link a survivor directly to a service they're seeking. Nearly 6,000 survivors, that's 5,600 roughly, requested direct links to services in Illinois. Number 3 for Chicago was legal advocacy for order of protection. This is when legal advocates assist survivors in filing an order of protection. Legal advocates are not lawyers, but they can help survivors navigate the complexities of the legal system. In Chicago, nearly 2,000 survivors requested assistance with illegal advocacy for order of protection. Number 4 for Illinois and Chicago are the same. They were both crisis intervention and emotional support. This happens when a survivor calls into the contact and they are in a state of emotional distress. Sometimes survivors contact the hotline directly after an emergency, and VERAs are trained to help support them in navigating the emotions of that situation as they seek assistance with services. Both 9% of contacts in Illinois and 9% of contacts in Chicago requested crisis intervention and emotional support. That's around 5,000 contacts in Illinois and around 1,600 contacts in Chicago. Number 5 in Illinois was legal advocacy for order protection. That was nearly 4,000 survivors. And then number 5 for Chicago was direct links to services. That was around 1,500 survivors. Number 6 for both Illinois and Chicago was affordable or transitional housing. This is different than domestic violence shelter, which is short-term emergency housing. Affordable or transitional housing is meant to help transition survivors to more permanent, affordable, and safe shelter. In Illinois, 4% of survivors, around 2,300 survivors, requested assistance with affordable or transitional housing. And in Chicago, nearly 1,000 survivors requested assistance with affordable or transitional housing. Number 7 for Illinois was counseling. That is just what it sounds like. When survivors request counseling assistance to help them cope with the situations that they are in, they can contact the hotline and help receive counseling services. Nearly 2,000 survivors in Illinois requested counseling services. Number 7 for Chicago was civil legal representation. This is different than legal advocacy because it connects survivors with legal attorneys that can assist survivors with a complex array of legal needs. Nearly 600 survivors in Chicago requested assistance with civil legal representation. Number 8 for Illinois was civil legal representation, and number 8 for Chicago was counseling. So those two are switched for Illinois and Chicago. And then both for Illinois and Chicago, number 9 was public benefits and financial aid. This encompasses a broad range of public benefits like SNAP and also includes the network's Survivor Fund. Number 10 was domestic violence support group, where survivors can be connected to groups that can help them cope with the emotions of their harmful situations. Domestic violence shelter continues to be the number 1 need articulated to the Illinois Domestic Violence Hotline by survivors. In 2024, the hotline received a record-breaking nearly 19,000 requests for shelter. Hotline staff maintain communication with every shelter to establish bed availability. They update this list every day, sometimes multiple times a day, and it allows them to connect callers to the nearest shelter with available beds. In 2024, shelter capacity could not meet the demand for the number of survivors who called into the hotline requesting domestic violence shelter. The hotline estimates that there are at least 704 shelter beds across the state, almost 100 in Chicago, more than 163 in the Chicago suburbs of Cook, DuPage, Lake, Kane, and McHenry counties, as well as more than 444 across 21 other central and southern Illinois counties. For more than a third of the year, that's 130 days, Chicago did not have shelter beds or cribs. And for just under half the year, 173 days, the suburbs did not have shelter beds or cribs. This impacts a survivor's availability to escape dangerous situations and recover from harm that has occurred at the hands of their abusers. Though there are no days without shelter beds or cribs in the rest of the state, that's central and southern Illinois, there may not be accessible beds to survivors for a variety of reasons. A survivor cannot have access to public transportation, and so they can't travel to reach an open shelter, or they might be 3 counties away from the available bed in central or southern Illinois and might not be able to travel to reach that bed. So even though there are no days without shelter beds or cribs in southern or central Illinois, all across the state, survivors face barriers in getting domestic violence shelter. When shelters are full or survivors cannot ask services, they call the hotline repeatedly, again and again, to get shelter. Sometimes this is multiple times a day, sometimes this is for weeks until a bed opens up. When survivors go a long time without receiving the care that they need, they not only face dangerous situations, but they also might be discouraged from reaching out again. And they might also believe that, the service might not help me, I won't reach out again. So it's especially important that shelter capacity expands to reach the demand of survivors. We have a Vera story for you, highlighting the work of both Vera and a survivor to help them receive domestic violence shelter. And I encourage you to read it to understand what a request for domestic violence shelter might look like on a day-to-day basis. There is also a growing demand for affordable housing, which helps survivors transition out of the shelter system and emergency system or avoid it together by finding them affordable and safe housing. In 2024, the hotline received 2,325 requests in Illinois for affordable housing. That's a 77% increase from 2023. In Chicago, the hotline received a just as dramatic increase of 980 requests. That's a 67% increase from 2023, and almost 5 times the number of requests since pre-pandemic 2019. This growth may be in part to the network's growing housing assessment program. In this program, housing assessors at the network can conduct eligibility screenings and assessments for rapid rehousing available for survivors through the continuum of care. This helps survivors get closer to receiving affordable housing. There has also been a growing demand for public benefits and financial aid assistance. This could be contributed to several things. One is an economic destabilization that happened as a result of losing certain programs after the pandemic. So during the pandemic, the American Rescue Plan Act had a lot of program extensions, like extended unemployment and extended benefits. These things came to an end after the pandemic, which is why we could be seeing an increase in requests for public benefits and financial assistance. We also could be seeing an increase in requests due to the growth of the Network Survivor Fund program. Since 2022, funding to the program has increased, as well as capacity of the program and awareness of the program. This could contribute to this large spike in data in context to the hotline about public benefits assistance since 2019. In 2024, there were 909 requests in Illinois. This is relatively stable compared to 2023, but it is 5 times the amount since pre-pandemic 2019. And in Chicago, there were 363 requests, again, relatively stable, about a 1% increase, but a 4 times growth since 2019. We are also seeing a new normal in legal advocacy need. Since COVID, we have seen kind of a spike in legal advocacy need and then a slight dip. This could partially be because during COVID, the courts introduced a remote access option that made the process a little bit more complex and might have contributed to a higher need of legal advocates. A higher need for legal advocates. But as the system returns to normal, we see that need slightly drop. It is still above pre-pandemic 19 levels. It is 74% higher than pre-pandemic 19 levels, but it is less than the post-COVID spike. In 2024, the hotline received nearly 4,000 requests in Illinois. That's an 11% increase since 2023, and nearly 2,000 requests in Chicago. That's a 4% increase since 2023. And then I will hand it off to Shelby to discuss the programs and processes that the hotline has to address survivors' needs.
Thanks for that, Imuna. We've had the chance to hear a lot about survivor needs already, and in some cases, places where our current service environment has sort of a shortfall related to the size of demand. And so many programs have emerged here at the hotline to accommodate some of those needs. That's what we're going to talk about next. So as I mentioned, these programs are largely aimed at filling some of the gaps that we have seen in our information ecosystem as well as our service ecosystem. And as we move into talking about some of these hotline-specific programs, I really want to raise another story from our report. You've already seen one of these in Imuna's slides. And what I will add is that, if you don't have more than 5 minutes in your day to review the report, we would really encourage you to take a look at our executive summary, as well as the stories throughout the report from Vera's. They really, I think, illuminate the complex lives that survivors are leading, and the ways in which they may interface with, multiple service needs at once to move from an unsafe situation into a safer situation. The story you see here, It Takes a Village, I will give folks just a beat to read. It covers how one survivor touched almost every program that we're about to discuss in their journey to safety. So we'll give folks just a beat here to take a look at that. First and foremost on this list is a relatively new process at the hotline. It was introduced in the fall of 2023, and that is recording references to firearms among callers and providing some additional safety planning in response to those disclosures. Prior to this process, there was no uniform routine data collection about the prevalence of gun violence among Illinois survivors specifically in the state. And we felt strongly that that was an information gap that needed to be addressed. As a result of that, VERAs have started to record anytime a disclosure of firearm violence does happen. And in 2024, we have our first full year of data from the program, or new process, I should say. In 2024, we had 1,169 disclosures of firearm risk among callers. That is about 2% of all contacts to the hotline last year, which lines up pretty closely with our early data from the last quarter of 2023, which was also averaging about 2% of contacts. So things feel relatively stable, and it's really valuable to hear a little bit more about what proportion of the folks we're interacting with are facing this particular kind of risk. We know that the intersection of domestic violence and firearm violence is incredibly high risk. The risk of domestic violence homicide increases 500%, fivefold, when a firearm is present in a domestic violence dynamic. And as a response to that, we all need to be prepared to help survivors facing that unique threat. The network is developing and conducting trainings on an updated version of our firearm safety planning toolkit in the wake of the passage of Karina's Law, which was the network's flagship legislation addressing some of the issues at the intersection of firearm violence and domestic violence that passed earlier this year and went into effect this May. So keep your eyes peeled on our website and training links for more information about that resource as it rolls out. We also, of course, have our Safe Rides program. And the Safe Rides program is a process by which VERAs are able to coordinate complimentary Uber Health rides for folks who are contacting a hotline in need of transportation assistance. Uber Health, as I mentioned earlier, is a little different than your standard Uber ride. It's particularly a confidential service that allows VERAs to coordinate and actually follow along through the duration of the ride for a survivor without having to disclose any of their personally identifying information. This allows us to take a survivor from a safe place like a public area by their house to a safe place. For example, this might be a friend or family member's home. It might be a domestic violence shelter or court or a doctor's appointment, really anywhere that they are going to be safe and need to be, that the person who's causing them harm wouldn't be able to find them at. We're very pleased to say that this program saw substantial growth in 2024. We actually doubled the number of passengers that we were able to take to safety compared to 2023, about a 94% increase. You'll see here as well that on average, those rides cost about $43.32 to provide and took folks on average about 26 miles to safety. Overall, we provided more than 2,200 rides to survivors. That included 2,278 adult survivors, 1,137 children, and 41 beloved pets. We are also pleased to share that we have partners on the After Hours Order of Protection program here in Cook County since the fall of 2023 as well. We joined as a program partner, and the other partners in that mix are the Domestic Violence Division of the Cook County Court System and Connections for Abused Women and Their Children, a DV service provider, also commonly known as CAWC. The way the program works is it is available to survivors outside of standard court hours, which includes 9 p.m. to 3 a.m. on weekdays and 1 p.m. to 6 p.m. on weekends. And here's kind of how somebody might interface with the program. A survivor would call the hotline during those after hours windows and let a VERA know that they're interested in filing for an order of protection. When they do that, VERAs are able to answer questions about the process and also help to assess their eligibility for the process. That might look like anything from, establishing if they have a qualifying relationship, venue, and experience of violence in order to file. But it could also be a little more nuanced than that, right? Helping people think through if now is the right time to file. For example, will you be able to attend court during business hours for the duration of your case if you're not able to join us today in normal business hours and are using our after hours program? Things like that. The vast majority of people who call do qualify. And when that happens, an eligible caller is then patched through to CAWC for assistance with the actual drafting of an order of protection. There are some times where CAWC is at capacity, and in those cases, the hotline bureaus are actually filing that order of protection with the survivor directly. So we were able to sort of tag team that as needed. Overall, in 2024, there were 944 assessments for OP eligibility. The majority of those, 872, qualified. And the majority of those went to CAWC. 827 OPs were filed by their program. Orders of protection were also filed by VERAs when that capacity issue was in place. That happened 45 times last year. And what you won't see on the slide, but what is in the report is a really interesting chart of month-by-month filings over the course of the year. And it's very clear that interest in the program has grown as information about it has become more widely available. So every month we've had growing utilization of the program, which seems pretty clear, like an indicator that it really has helped to expand access to justice for folks who perhaps aren't able to do that initial filing during the day. We also have our crisis housing program, which saw substantial growth last year as well. And this is a really direct response to that shelter crisis we were talking about earlier in the presentation. Given that so many Chicago area shelters are struggling with bed availability, the hotline tries to supplement that by providing temporary hotel stays to families through our crisis housing program. Importantly, this is contingent on funding being available for the program and also having a partner domestic violence agency. The reason we do this is because when somebody goes to shelter, they're receiving so much more than just a safe roof over their head. They're receiving these really high quality wraparound services from a trauma-informed provider who's making sure to meet all of their needs. In a hotel, that's not as readily available. And so we partner with those local domestic violence agencies to ensure that the clients have access to an advocate to provide that same kind of high quality wraparound service care. We saw really dramatic growth in this program last year. You'll see actually at the very bottom of this image, we had 4 times as many survivors housed in 2024 than we did in 2023. To give you a little overview of what the program was able to do, we provided 670 survivors with hotel stays. That includes 292 adults, 328 children, and 50 pets. And this is about 6,630 days of shelter combined. I will flag here that we calculate days of shelter provided a little differently than a traditional shelter might. And you'll see in other editions of measuring safety, like for example, our gender-based violence services edition, which reports shelter services, their clients, their reach, etc. There you will find that shelters calculate days of shelter provided by person. We calculate by family unit. To give you an example of what I mean, if we were to provide a family of 4 shelter for a week, we count that as 7 days of shelter provided. But a traditional shelter might count that as 28 days, right? Because there are 4 people, each of them receiving 7 days. So if you're ever comparing numbers, just know that ours are tabulated a little differently. On average, this means that each family received about 20 days of temporary hotel stay from our program, which was at the cost of about $800,000. On average, that's about $2,739 per family. And like I said, this is a 4-fold increase from 2023. So we are very pleased to have been able to reach more people and hope to continue to do so. All right, we're reaching the end of the data section of our report, and I want to just give us a beat to breathe and to reflect on everything that we heard, because there are some implications of the data, primarily this. The hotline has demonstrated year over year in each of the reports we've conducted that it plays a really life-saving role in safeguarding survivors across the state. We hear from people in every community, and that means that domestic violence isn't limited by geographic boundaries. And no matter where somebody is when they're reaching out for support, we need to be prepared to provide them that support. You've seen that services needed to move a survivor into that more safe place, they are wide-ranging and often stacked on top of each other to get people exactly where they need to be. And it's critical that the hotline maintain both public and private funding to continue providing these essential services. We will name that 2025 is the final year of American Rescue Plan Act funding, which specifically supported the growth of many gender-based violence services here in Illinois. And we feel strongly, of course, that all of the data in the hotline report makes clear that local and state funding must remain level even once these ARPA dollars are gone, to ensure that we're able to continue to meet survivors' needs when they're brave enough to ask for help. We will move on to a quick, exciting preview of a new upcoming resource. So we are very pleased to share that we will be posting a legislative district hotline data database on our website soon. For folks who perhaps have never seen earlier editions of Measuring Safety, last year, we published for the first time hotline data by legislative district as an appendix to last year's hotline report. That was an 80-page long appendix. And what we heard from our community was that it was really great information, but it wasn't a great method of delivery. And in order to put that information to work, which is always what we hope you will do, it needed to be a little bit more interactive, user-friendly, all that good stuff. So what we did is put our heads together and worked with a web development team to make our first ever district level hotline data report database on our website. And the way this will work is that there will be filters in this database for zip code, congressional district, Illinois House and Senate districts, and Chicago wards that will allow you to take a look at what hotline contacts look like in your community, and hopefully prepare you to have informed, engaged conversations with your own elected officials about domestic violence resources in your community. In addition to being searchable and easily customizable to your needs, you'll also have access to these really beautiful, like printable pages with all of the numbers and all of the context you need to have an informed conversation with your elected official. And we have like a little demo here for you. Note that this is still in development. So of course we don't have all of our text even in English yet, but what you'll see here is all of those filters I mentioned, as well as the ability to click into any district you're interested in and access both those numbers and that context. We're super excited to be launching this resource and expect for it to be out in mid-July. We hope that you will stay connected with our team and with the project of Measuring Safety. The best way to do that is to hop over to our website and make sure to visit our Measuring Safety landing page. You can scan this QR code on the screen right now and it'll take you right there. While you're there, of course, you're able to download our report, which is full of information. We really only scratched the surface in today's presentation. You can also sign up for our mailing list, and that will ensure that you get notified every time a new report comes out. It'll ensure that you get access to the recording of today's presentation. And you'll be the first to know when that database launches on our website in July. And for anybody in the room who is in the world of communications, we do also have a social media toolkit for each report. And you can access that toolkit as well if you'd like to share information about what you learned today in your own networks. A big thank you to everyone who joined us today. If you have any follow-up questions, you're welcome to follow up with myself or Yamuna. You can go to our website and download our report today. So we are grateful to have you here and hope you are taking away what you hope to learn from today's presentation.